As our health needs grow, sometimes the space that helps us heal needs to also. That's why after years of planning and preparation, Talbot County has unveiled a new space with exciting new additions too.
That includes everything from physical spaces for community events to brand new health programs. So we sent our James McDonald to give us an inside look at the building and show us some of the latest programs that they now offer.
The anticipation is building for Talbot County Health Department's new centrally located facility.
We're at 510 Cadmus Lane, which is right off of Dutchman's Lane in Easton. So we're in central Easton, which is very accessible to a lot of our clients, both by car and by walking.
As patients' needs have changed, the health department knew they needed to make adjustments that match.
We were really bursting at the seams in our old building, and it was built in 1967 at a time where there were definitely different public health and community needs, and so we definitely needed more space for both employees, but also to expand our services and really to adapt to the modern needs of public health. We really wanted to make sure it was a thoughtful process where we were responding to current needs, but also making sure that in the future we had adequate room to grow and be flexible with future demands.
The building is equipped with exciting new features.
We have all of our staff in one central location so they can more easily collaborate. We have a really large conference room, and we've already got on the books some great events that the community is going to host here. And one of the fun things for us, maybe not for the client-facing public, is we have a great warehouse, which is something we realized during the pandemic we really needed with all of our PPE coming in. We have a much bigger clinic space too, which is important because we're trying to expand a lot of our clinical services. So we actually doubled the number of our clinical exam rooms so we can see more patients come in for those types of services.
The vaccine room is the most adorable room, and we have already had children come in. They're playing with the toys, they're reading the books, they're looking at themselves in the mirror. So really being able to spruce that room up and provide a comfortable environment where we can begin to build trust with little children with healthcare system that's going to last a lifetime is super, super fun.
And new public programs, too.
The expanded services are going to be family planning or reproductive health, STI, which is sexually transmitted infections, so we're going to test for those and we're going to treat for those. And then eventually we're also going to add in women's health. So women will be able to come to us for their breast exams, their pap smears, and all of their annual sexual health needs. And so those are the things that are coming on the horizon. And then things that we currently offer are the VFC, or the Vaccine for Children's program. So if somebody is uninsured or underinsured, they can come here and have their children vaccinated. We also offer rapid HIV and hepatitis testing. We have our, again, CPEST program, which is the colorectal program. So if somebody is uninsured or underinsured, we can help link them to getting a colonoscopy or even accessing Cologuard in some cases, if that's appropriate. We're trying to understand the trends, and we're trying to understand how to prevent some of these things from happening upstream by providing education.
Talbot County Health is grateful they can offer a space that brings the community together for years to come.
The most exciting thing is just the capacity that we're building, not only from the physical space that we're now in, but also just thinking about the future and how we can really innovate around healthcare.
The beauty of this facility is that we can really adapt in the future, and this will be our home for a very long time.
And that patience sure pays off.
Talbot County is also planning to bring the services they offer to the outlying communities like Tillman Island and Cordova, where they haven't had them.
Yeah, that's really important that they do that.
And they see them and they come out.
Yeah, that's great.
It's incredible.